Let's take a moment and talk about something many overlook, something that seems so basic, yet it holds incredible power over our health, comfort, and dignity: bathing. Yes, showering. Now, if you've been raised in a generation where cleanliness was close to godliness, you might think showering every single day is the gold standard. But for older adults, our beloved seniors, the story is a little different. You see, as we age, our skin changes. It becomes thinner, more fragile, and far more prone to dryness. Daily hot showers, although refreshing, can strip away the very oils that keep the skin soft and protected. What once felt energizing may now leave the skin irritated, flaky, and even vulnerable to infections. So what are doctors saying? Most medical experts now recommend that seniors shower 2 to 3 times a week, not because hygiene isn't important, but because balance is. Spot cleaning, especially of private areas and underarms, can be done in between. What matters more than frequency is thoroughness and gentleness. But here's another layer. Bathing isn't just about the body, it's about the mind too. A warm shower can soothe sore muscles. It can bring a sense of calm. For many, it's a cherished moment of solitude, clarity, and emotional reset. That's something no one should be denied at any age. Still, we mustn't ignore the risks. Slippery tiles, lack of support, or even a moment of dizziness. And suddenly, something as simple as a bath becomes dangerous. That's why safety is essential. Non-slip mats, grab bars, and if needed, a helping hand, not out of pity, but out of love. And finally, let's remember this. No two seniors are the same. Some are active, some are bedbound, some sweat more, some live in humid climates. So the real wisdom lies in listening to your body, not following a rule book. If you feel fresh, if your skin is healthy, if your heart is at peace, then you're doing just fine. So to our seniors and to those who care for them, don't get lost in the numbers. Don't feel guilty if you skip a day. Instead, choose intentional care, not routine. Because staying healthy and living longer isn't just about what you do, it's about how mindfully you do it. Take care of your body, nurture your skin, but most of all, honor your rhythm. You've earned it. As we grow older, our skin undergoes many changes. It becomes thinner, more fragile, and less capable of retaining moisture. The oil glands that once kept the skin supple and hydrated become less active, and the natural protective barrier starts to weaken. This is why many doctors and dermatologists now caution against over-showering in older adults. While it might seem like frequent bathing is a sign of good hygiene, in the case of seniors, it can often do more harm than good. Every time we shower, especially with hot water and strong soaps, we wash away the body's natural oils. These oils are crucial for maintaining skin health, preventing dryness, and keeping the skin's protective barrier intact. When older adults shower too frequently, particularly with harsh soaps or high water temperatures, they can strip away these oils and leave their skin dry, flaky, and irritated. This isn't just a cosmetic issue. Dry skin in seniors can crack and lead to small wounds, increasing the risk of infections. In more severe cases, excessive dryness can contribute to chronic skin conditions such as eczema or dermatitis, which can be painful and difficult to manage. Beyond the physical discomfort, there is also a psychological impact. Itching, irritation, and visible skin damage can lower self-esteem and contribute to feelings of frustration or embarrassment. Seniors may begin to associate bathing with discomfort, making them avoid it altogether, which then swings the pendulum in the opposite direction, leading to poor hygiene and related health issues. It becomes a cycle that many don't talk about but silently endure. Additionally, it's important to consider that many seniors have other conditions such as diabetes or poor circulation, which already make their skin more sensitive. Over-showering in such cases can make their skin even more vulnerable, complicating their overall health. That's why many medical professionals now emphasize moderation and mindfulness in personal care routines. Showering 2 to 3 times per week is usually sufficient to maintain cleanliness without compromising skin health. In between, spot cleaning with a gentle washcloth or sponge can be just as effective. So, it's not about being less clean. It's about being smartly clean. Seniors deserve comfort and health in every aspect of their lives, and how they care for their skin should reflect that same balance, respect, and attention to what their body truly needs. For many of us, bathing daily has become more than just a hygiene practice. It's a habit, a routine embedded deeply into our lives. We often equate daily showers with cleanliness, discipline, and even self-worth. But when it comes to older adults, this routine may need a shift in perspective. The truth is, while hygiene is essential at every stage of life, the way we approach it must adapt with age. And in this case, balance truly is the key. As the body changes, so do its needs. For seniors, the skin becomes thinner, less elastic, and more prone to dryness and irritation. The oil glands that once kept the skin naturally moisturized begin to slow down, and the body's ability to regenerate skin cells isn't what it used to be. In this new reality, maintaining hygiene does not necessarily mean daily showers. It means understanding what the body actually requires to stay healthy, and more importantly, what it doesn't. The idea of hygiene being tied to daily bathing is more cultural than medical. While it may feel refreshing and clean for older adults, excessive showering can strip the skin of its essential natural oils, disturb its microbiome, and lead to chronic dryness. This can cause a cascade of problems: cracked skin, irritation, and even open wounds, all of which increase the risk of infection. It becomes a case of too much of a good thing turning harmful. That's where balance comes in. Experts now suggest that showering 2 to 3 times a week is often sufficient for seniors, especially if they are not overly active or exposed to dirt and sweat regularly. In between, areas prone to sweat and bacteria, such as underarms, feet, groin, and skin folds, can be gently cleaned with a washcloth or sponge. This approach not only maintains hygiene but also protects skin health in the long run. It's important to recognize that personal care doesn't have to follow a rigid pattern. The goal is to feel clean, comfortable, and confident, not to meet some arbitrary standard of cleanliness. For caregivers and family members, it's vital to help seniors feel in control of their hygiene routine without making them feel ashamed or pressured into habits that may no longer suit them physically. By shifting the focus from habitual daily bathing to intentional, balanced care, we can support better skin health, reduce the risk of unnecessary discomfort, and empower seniors to make choices that respect their changing bodies. Hygiene should enhance well-being, not compromise it, and achieving that starts with listening to what the body truly needs, not just what tradition tells us to do. Personal hygiene plays a vital role in maintaining overall health, and this importance becomes even more pronounced as we grow older. For seniors, practicing good hygiene isn't just about looking or feeling clean. It's a direct line of defense against infections, illnesses, and even more serious medical complications. As the body ages, the immune system weakens, making it harder to fight off bacteria, fungi, and viruses that younger bodies might fend off more easily. This makes personal hygiene not just a matter of routine, but a crucial preventive health measure. When hygiene is neglected, even unintentionally, harmful microorganisms can begin to thrive. Areas like the underarms, groin, feet, and skin folds are especially prone to moisture and warmth, creating ideal environments for bacteria and fungi to multiply. If not cleaned properly and regularly, this can lead to skin infections, fungal conditions like athlete's foot or candidiasis, and even more serious bacterial infections such as cellulitis. These may seem minor at first, but in seniors, even small infections can escalate quickly and lead to complications that require medical intervention. Moreover, oral hygiene is a critical yet often overlooked aspect of personal cleanliness. Poor dental care can result in gum disease, tooth decay, and even systemic infections if bacteria enter the bloodstream through inflamed gums. This can be particularly dangerous for seniors with pre-existing conditions such as heart disease or diabetes, as it can worsen their overall health. Regular brushing, flossing, and dental check-ups are just as important as bathing and skincare. Another key point is that maintaining good hygiene helps prevent the spread of contagious illnesses, not just to the individual, but also to those around them. In group settings like nursing homes or assisted living facilities, where many seniors reside, infections can spread rapidly if hygiene isn't prioritized. Hand washing, proper toileting practices, and regular cleaning of personal items such as dentures, hearing aids, or mobility equipment all contribute to creating a healthier, safer environment. Good hygiene also has psychological benefits that indirectly support disease prevention. Seniors who maintain a clean body and living space often feel more confident and motivated to engage in daily activities. This engagement leads to better physical movement, improved appetite, and even better sleep, all factors that contribute to stronger immunity. On the other hand, neglecting hygiene can lead to feelings of depression, social withdrawal, and even neglecting other aspects of health, which increases vulnerability to illness. In the end, personal hygiene is far more than a surface-level concern. It's an essential component of disease prevention, a reflection of dignity, and a daily opportunity to protect the body and mind. For seniors, embracing hygiene practices with intention and awareness not only supports longevity, but also nurtures a better quality of life. Bathing is often seen as a physical necessity, a routine for cleanliness. But for seniors, especially, it goes far beyond just removing dirt or sweat. It can become a powerful tool for emotional balance, mental clarity, and inner peace. As we age, we may begin to lose control over many aspects of our lives: mobility, energy, social connections, and sometimes even independence. In such circumstances, something as simple as a warm bath or shower can offer a sense of control, comfort, and renewal that deeply nourishes both the body and the mind. For many older adults, bathing can be a form of therapy, a moment of solitude that allows the mind to slow down and reset. Warm water has a naturally calming effect. It relaxes tense muscles, improves blood circulation, and soothes aching joints. But even more than that, it helps release stress and emotional tension. The sensory experience of warm water against the skin, combined with the sound of flowing water, can calm an anxious mind and bring a sense of grounding and stability, something that is often needed in the face of aging's unpredictability. Bathing also offers a quiet space for self-reflection. In a world that often moves too fast, and in an age where one might feel increasingly invisible, those quiet minutes in the bathroom can become sacred. It's a chance to reconnect with oneself, to be present, and to feel renewed, not just externally, but emotionally. Many seniors report that they feel lighter after a bath, not just because their body is clean, but because their thoughts have been calmed and their emotions softened. There's also a psychological benefit to feeling clean. It enhances self-esteem and restores a sense of dignity. Seniors who are able to maintain regular bathing routines, either on their own or with assistance, often feel more confident interacting with others. They're more likely to go out, participate in social activities, and express themselves. In contrast, when hygiene is neglected, it can lead to a sense of shame or embarrassment that fuels isolation, loneliness, or depression. In some cases, bathing can even improve sleep. A warm bath before bedtime has been shown to help regulate the body's temperature and signal the brain that it's time to wind down. For seniors who struggle with insomnia or disrupted sleep, which is very common in later years, this can make a meaningful difference in rest and recovery. Whether it's a full bath, a gentle shower, or even a sponge bath with soothing scents and soft cloths, the emotional impact remains significant. It's a ritual of self-care, a moment of stillness, and a reminder that they are worthy of comfort, dignity, and peace. For caregivers and loved ones, helping seniors maintain this routine with respect and sensitivity can offer more than physical benefits. It can uplift their spirit, strengthen their identity, and promote emotional well-being in a way that no medication or therapy ever fully could. The bathroom, though often seen as a place of routine and comfort, can become one of the most hazardous spaces for seniors. As we age, our bodies go through numerous changes. Balance becomes less stable, reflexes slow down, muscles weaken, and vision may deteriorate. These natural shifts, while expected, significantly increase the risk of slips, trips, and falls, especially in environments where water, slick surfaces, and tight spaces come together. And that's exactly what a typical bathroom presents. For many older adults, a simple shower can turn into a source of anxiety rather than relaxation. The act of stepping over a bathtub ledge, standing for several minutes on a slippery surface, or turning suddenly to grab a towel can lead to dangerous falls. In fact, bathroom-related injuries among seniors are alarmingly common and can result in broken bones, head trauma, or extended hospital stays, sometimes even leading to long-term disability or loss of independence. Adding to the danger is the fact that many seniors are often alone when bathing. If a fall occurs, it may take hours before help arrives, especially for those living independently. The combination of hot water, dizziness, or even medications that affect blood pressure or alertness can further increase the risk of fainting or disorientation during bathing. These aren't just minor concerns. They are life-altering risks that deserve serious attention. Yet, despite these challenges, bathing doesn't have to be dangerous. With the right precautions and adjustments, the bathroom can once again become a safe and calming environment. Simple additions like non-slip mats, sturdy grab bars, and shower chairs can provide necessary support and reduce the likelihood of accidents. Handheld shower heads make it easier to wash without excessive movement, and installing a walk-in shower or tub can eliminate the hazard of stepping over high edges. Even proper lighting and having essential items within arm's reach can drastically lower risk. Another important part of safety is recognizing when assistance is needed. Many seniors are understandably proud and independent, and the idea of someone helping them bathe can feel uncomfortable. But needing help doesn't mean losing dignity. In fact, having the right support, whether it's a loved one or professional caregiver, ensures that bathing remains a comfortable, empowering experience rather than a fearful one. Maintaining physical safety in the bathroom isn't just about preventing injuries. It's about preserving freedom, confidence, and peace of mind. When seniors feel safe, they're more likely to maintain good hygiene, which in turn supports their physical health and emotional well-being. It's not about taking away independence. It's about creating an environment that protects and supports it. As we move through the stages of life, one truth becomes clearer: the body is always speaking, in subtle shifts, quiet discomforts, and moments of clarity. For seniors, tuning into these messages is not just important, it's essential. Listening to your body's rhythm and needs means recognizing that what worked at age 30 or 40 may no longer be ideal at 70 or 80. This applies to everything from eating habits and sleep patterns to something as seemingly simple as bathing. The reality is that there is no universal rule for how often a senior should shower. One person might be very active, enjoy gardening or walking daily, and need more frequent cleansing. Another may be less mobile, spending much of their time indoors, and find that a full shower 2 or 3 times a week, with spot cleaning in between, is more than enough. Respecting the body's rhythm means honoring these differences without judgment or guilt. Instead of adhering to rigid routines out of habit or social expectation, seniors benefit more by practicing mindful self-care. Dry, itchy skin might be a sign to cut back on showers or switch to milder soaps. Feeling sticky or sweaty may signal the need for a quick rinse or a refreshing sponge bath. The body gives cues. It tells us when it's tired, when it's clean, when it needs comfort. But so often, we override these signals with routines that no longer serve us. There is also a deeper emotional layer to this. Listening to the body is an act of self-respect. It's a way of saying, I see you, I hear you, and I trust you. That's incredibly empowering, especially for seniors who may feel that much of their autonomy is being slowly taken away by age or illness. Making personal hygiene decisions based on how they actually feel, rather than what they've always done or what others expect, reinforces a sense of agency and personal dignity. This approach also creates space for flexibility. On one day, a full bath may feel energizing. On another, it may feel overwhelming, and a gentle wipe down may suffice. That's perfectly okay. Aging gracefully doesn't mean forcing yourself into routines that don't align with your current needs. It means adapting with kindness, with awareness, and with compassion for the body you live in. Caregivers and family members also play a key role here. Encouraging seniors to express how they feel rather than insisting on a fixed hygiene schedule can go a long way in building trust and promoting genuine well-being. After all, no one knows the body better than the person living in it. Ultimately, listening to your body's rhythm is about tuning into your own wisdom, the kind that doesn't come from books or advice columns, but from lived experience. It's about moving away from the rigidity of what's normal and leaning into what's right for you. And in that quiet, intuitive space, health, comfort, and peace tend to follow naturally. In conclusion, understanding how often seniors should shower isn't just about hygiene. It's about health, safety, emotional well-being, and above all, respect for the body's changing needs. As we've explored, over-showering can damage fragile skin, while under-showering can open the door to infections. But between those extremes lies a thoughtful balance, one guided not by habit, but by awareness. Bathing becomes more than a routine. It becomes a personal ritual of care, a moment of emotional healing, and an opportunity to listen to what the body is truly asking for. Every senior is different. Some need more, some need less. What matters most is not the frequency of showers, but the intention behind them. To protect the skin, preserve dignity, ensure safety, and foster emotional comfort. When we begin to see bathing through this compassionate lens, we stop treating it as a chore or checklist and start embracing it as an act of self-love. So whether you're a senior learning to adapt or a caregiver supporting someone you love, remember this: cleanliness is not a rigid standard. It's a personal journey. Let it be guided by kindness, wisdom, and the gentle rhythm of the body that has carried you this far.